this webinar. So interesting conversation, timely, certainly with some of the information that's come out here in the news lately. The title here is Acetaminophen Use, Its Multiple Mechanisms of Toxicity and the Link to Liver Damage and Neurodevelopmental Disorders. So I typically don't like showing me on video only because it blocks some of the screen. So I'm just going to do a quick introduction if you're not familiar with me. I've been an integrative and functional medicine physician since the late 90s. I am founder and clinical education director for Integrative Medicine Academy. I wear a lot of hats. I'm involved in other projects. I'm the host of Functional Medicine Doc Talk podcast, for example. And in my own practice, I work a lot with individuals who are autistic, special needs children, other people with chronic and environmental induced health conditions. So one of the things too is I'd encourage you to stay to the end. I do have a special a coupon code for courses and membership within our Integrative Medicine Academy if you're interested. So stay to the end to receive that information. Okay, so let's get into the topic here. So this is just a summary of acetaminophen toxicity. It is associated with many different types of problems, but we're going to look a little bit at some of the pterogenetic aspects, so being linked to birth defects, for example. It does have some association with autism, which we're going to talk about here. One of the things about acetaminophen is it essentially denatures many proteins, particularly those that contain sulfur-based amino acids. And then it can cause severe metabolic acidosis, kidney failure, liver failure, and death. And then it's actually the leading cause of liver failure and subsequent death, which is pretty surprising. And a lot of the toxicity comes about because of some of the metabolites that our body, when it's acting upon acetaminophen, gets produced. So NAPQI, for example, is a toxic metabolite. We need to have adequate glutathione in order to render it less toxic. But if we have too much NAPQI, it can take out our glutathione reserves. And one of the things to keep in mind is that here in the US, I don't know what the statistics are throughout the world, but here in the US, we're looking at about 500 people every year die from acetaminophen acute liver failure. And there's thousands of people hospitalized. It's a big, big problem. So in general, there's approximately 56,000 emergency room visits every year from acetaminophen overdose, hospitalizations, about 2,600 deaths, about 500. Now, the mechanisms of harm are many, and our liver goes through a series of different biochemical reactions to get rid of acetaminophen. NAPQI formation is one of those. Sulfation, glucuronidation play also a big role too. So we'll come back to this particular slide shortly. So this is just a screenshot of acetaminophen. And if you look at what's interesting, now this is talking about acetaminophen injections for intravenous use. This was originally approved in 1951. But one thing to pay attention to is that the warnings for hepatotoxicity are significant. So anybody who is taking more than what is recommended is putting themselves at great risk for liver damage. But you could also take appropriate doses of acetaminophen and still have problems. So there is warning labels all over these products. And so that is do not exceed the maximum recommended daily dose. I mean, this is well-known information. This is no secret. All it takes is for somebody to actually just read the label. And one of the things that happens with acetaminophen is it's metabolized through specific cytochrome enzymes in the liver, particularly this one here called CYP2E1. And other drugs and substances that we're exposed to, including many environmental chemicals, alcohol consumption, and other drugs also use that particular pathway. So if somebody is consuming alcohol or on other medications or perhaps being exposed to other kinds of environmental compounds, if that CYP2E1 is being occupied and you're taking acetaminophen, it increases the potential for acetaminophen accumulation in the body. and if you've got genetic variants of that particular P450 enzyme, that too could be problematic. And so there are specific dosage amounts for weight, so for adults, adolescents, and then children, for example. And again, just staying within the parameters of dosing has been well established. What's interesting from a pediatric standpoint is that the safety and effectiveness of acetaminophen in pediatric patients older than 2 years is essentially, as they say, supported by evidence from adequate and well-controlled studies that were done in adults with additional safety and pharmacokinetic data basically sort of extrapolated or brought down to this age group. I'm going to show you something about that particular statement that's a bit misleading, particularly when we look at this information with regards to autism. But the other thing to keep in mind is that they don't recommend acetaminophen dosing below 2 years of age, or at least it's not been studied in kids less than 2. I've had kids in my practice who've gone to get their 1-year-old vaccines or their age 1 vaccines at a year or 15 months or 18 months, for example, and the pediatrician recommends preloading with Tylenol. So, or, after the fact, taking acetaminophen if the child has a fever secondary to the vaccine. But again, the label information is saying, hey, there's been studies that have gone down to age 2, but not less than that. Now, there are other acetaminophen side effects: blood cancers, cardiovascular problems, bowel problems, nausea, vomiting, severe GI events, so medically significant events such as GI bleeding, and there's actually been cases of bowel perforation from taking acetaminophen. Renal disease and failure, we've already talked about the liver toxicity. And Stevens-Johnson syndrome is not unique to acetaminophen. That can occur with many different medications, but this is a life-threatening immunological reaction to a drug and can cause devastating effects throughout the body. So let's look at some information with regards to acetaminophen and autism. So an interesting article, this came out in 2024. This was from William Shaw. This is a hypothesis article that was published in the Integrative Medicine, a clinician's journal. Long title, I'm not going to read it, but we're going to focus on just a couple aspects of this particular article. This one here specifically on the pharmacological factors of acetaminophen exposure. If you're interested in reading this article, and I would recommend you get a copy, you can just go into your search engine and type in PMC 113-02971, and you can then download a copy at no charge. You can just download a PDF version and then print it out. So if you want to write this number down, PMC 113-02971, feel free to do so. It's a very in-depth article. It is complicated with some of the biochemistry, but it's important information to have. Okay, now, information taken from this article. And there's been all kinds of studies that have looked at this. So in one particular aspect, they looked at from 1974 to 2017, they did a keyword search using infant, paracetamol, or acetaminophen, and found 3,096 papers were referenced with those keywords. 218 made claims that paracetamol was safe for use on infants or children. By the way, paracetamol is just another name or version of acetaminophen. 103 of the 218 studies that said paracetamol was safe for use in infants or children were identified as sources of authority for the safety claim. Now, a total of 52 papers contained experiments designed to test safety, and these studies, had a median follow-up of 48 hours. So keep this in mind. A total of 52 papers contained experiments that were designed to test safety. These studies had a median follow-up of 2 days. None monitored neurodevelopment. So they were specifically looking at allergic reactions, immunological reactions, Stevens-Johnson syndrome, liver problems, kidney problems, etc. Another aspect of this paper referenced a particular study that was looking at 73,000, approximately 74,000 mother-child pairs that were included into this meta-analysis of autism and ADHD in Europe. And what they found was that children that were prenatally exposed to acetaminophen were 19% more likely to have diagnosis of autism spectrum disorder. 21% were more likely to have ADHD compared to non-exposed kids. So obviously there's a little bit of difference between oral acetaminophen because you're not getting likely the maximal amount that's being absorbed as opposed to an intravenous use, which was the slide that I showed you previously that was talking about some of the issues with intravenous acetaminophen. But orally absorbed acetaminophen, has very similar problems, particularly when used in excess. Now, what's interesting, this was a slide that I took from one of the courses I have within Integrative Medicine Academy. And this actually came from Dr. Bill Shaw in some of his research. To my knowledge, he's the only person that researched this information. And they were looking at comparing autism rates in Cuba as opposed to the United States. And this slide is probably about 10 years old, but essentially what they're finding in Cuba is that their autism rates are way less than here in the United States. So the US essentially, having almost 300 times higher rates of autism than in Cuba, but the vaccination rates are very similar. So much of the other parts of the world tend to follow our vaccine schedule. In fact, they tend to follow pretty much most anything that the FDA puts out as far as information on drugs, etc. What's the difference? Okay, well, here in the US, you can walk into any drugstore, grocery store, and pretty much buy as much Tylenol as you want, acetaminophen. And acetaminophen, you can't access it in Cuba. At least you couldn't many years ago. It was really only available by prescription and at best just not readily distributed. And what they found is around the world, companies that provide kind of open access to acetaminophen, or where it's encouraged more, or where it's being used, for example, in pregnancy, or being used in children, prophylactically for fever coming secondary to vaccines, tends to have higher rates of autism in those countries. And this was just an interesting scenario. So this was going back, looking at acetaminophen use, dating all the way back to the 1960s. So to help fever control, primarily aspirin was used for many years. But there was a major concern that happened in 1980 when there was a warning of something called Ray's syndrome that could occur secondary to aspirin use in children. So there was a switch over to acetaminophen. In 1977, warning labels recommended for acetaminophen products were placed on the packaging. Levels went up, and then in 1980, when there was a risk of Ray's syndrome, we saw a tremendous increase in the use of acetaminophen instead of aspirin. And that was also an increased rate of autism. So that took place from 1977 up to around 1978, excuse me. And then we saw another increase in autism rates after people stopped using aspirin and started using acetaminophen. And then I forget this fellow's name, but he was involved in murdering 7 individuals in Chicago, basically laced acetaminophen with cyanide. So there were 7 people that died. And what was interesting, acetaminophen use dropped off significantly across the United States, and autism rates pretty much leveled. And then a few years later, autism rates go again as people start incorporating more acetaminophen. In 1986, there was a second acetaminophen scare in New York. Again, cyanide-laced Tylenol, a woman died. We get a drop-off in autism for a while, and then again, a number of years later, it starts to increase as more acetaminophen is being used. Interestingly, in Guam, many years ago, Guam had a problem of these brown invasive tree snakes that probably came over on ships and wherever else, cargo vessels, and they didn't have any natural predators. So the government of Guam came up with an idea of poisoning mice. So they had these basically dead mice that they laced with Tylenol and then flew planes over the island, dropping the dead mice into the jungles and neighborhoods. And that was one way to control these tree snakes. The tree snakes came and ate the mice and then died secondary to Tylenol toxicity. So let's look at acetaminophen pathways of detoxification and some mechanisms of harm. So there's a lot of chemistry involved. And the way I look at something like this is paracetamol, just exchange acetaminophen. But there are primarily about 4 primary ways that we metabolize and get rid of acetaminophen. We can do it through sulfation. We can do it through what's called glucuronidation. We can do it through glutathione conjugation. And then there's a mixed bag of hydroxylation and methoxylation, which is a methylation reaction. So when I see something like this biochemically, the first thing I think is clearly the body wants to get rid of this compound, and it's using multiple pathways to do so. So acetaminophen sulfate combination, it takes place through phenyl sulfur transferase. What's interesting is that in autism, phenyl sulfur transferase is often compromised and felt to be weak. This is information that goes back many years. Also, phenyl sulfur transferase function can be adversely affected by Clostridia bacterial toxins. And there's a specific one that is found on the organic acids test from Mosaic Diagnostics, which I'll share with you shortly. We can form what's called glucuronide via glucuronidation. This is where we transfer a glucuronic acid to assist in making a particular compound more water soluble so that it's more easily excreted from the body. Typically, glucuronidation as a pathway of detoxification in the liver is characteristically weak in kids. Fetuses, newborns, and young infants typically don't have great glucuronidation capacity. Acetaminophen can go through a process called deacetylation to form something called p-aminophenol. So a phenol is this benzene ring with a hydroxyl group attached. And then we can see on the other side, it has an amine, a nitrogen and 2 hydrogens. The P means opposite, so it's just a p-aminophenol. So that's another pathway. And then a large part, or I should say a good proportion of acetaminophen gets converted to this particular compound called NAPQI via this P450-2E1 enzyme, which I had mentioned early on. Now, what's interesting about this reaction is that acetaminophen itself increases 2E1's activity in producing more NAPQI. So if you think about that, if you're taking acetaminophen, part of the process of getting rid of acetaminophen is to form NAPQI. We need glutathione to conjugate NAPQI to get rid of it. But by taking acetaminophen, the body increases 2E1 function to produce more NAPQI. Or I should say, actually, NAPQI induces more expression of 2E1. So here is NAPQI. Let me get a pen here. So here's our NAPQI, right? And NAPQI needs to attach to glutathione to become conjugated to get rid of it. But NAPQI itself, and the presence here, along with paracetamol, induce more movement to form more NAPQI. And that just puts a further strain on our glutathione reserves. In fact, this has been information that's been well known for years in that, let's see. This has been information that's been known for years about acetaminophen, is that it tends to, over a long period of time, compromise glutathione status. I've got a series of these slides, so let's look at this. Okay, so I mentioned that glucuronidation is an important detoxification pathway in the liver that gets rid of a bunch of different compounds. About 40 to 65% of acetaminophen is metabolized through glucuronidation. Now, remember, glucuronidation is very weak in children. So kids who are exposed to acetaminophen in utero, as well as a young child, are going to be a bit compromised because their glucuronidation system is not fully formed and fully functional. And it is the primary way that we get rid of acetaminophen. About 25-35% goes through the phenyl sulfur transferase pathway. About 5 to 12% goes through glutathione NAPK conjugation. And then there's, we have some others like the methylation and hydroxylation. So NAPK is a problem. Okay, and this is well documented that it will interfere or it needs glutathione to get rid of it, but it can also induce more 2E1 activity to make more NAPK. And NAPK, I mentioned early on that acetaminophen can really deactivate many proteins in the body, and it particularly goes after proteins that have what's called a sulfhydryl group as part of their chemical structure. So there are a number of different amino acids that have a sulfhydryl group. This is a sulfur and a hydrogen, so we have one on cysteine. Cysteine is important for glutathione production. N-acetylcysteine is another form of cysteine. N-acetylcysteine is also a precursor to glutathione. We've got methionine. Methionine has a sulfur compound. It too can get deactivated by NAPK. Methionine is very important in the methylation cycle. We've got glutathione. Okay, we've got N-acetylcysteine, as I mentioned before. And then we have another complex called cysteine. Cysteine is the combination of cysteine. This is important for redox reactions. Redox reactions are partly important for energy production, and cysteine also helps maintain proteins in more of a functional, dynamic, three-dimensional structure. If we look at methionine, okay, so this is our methylation and our transsulfuration pathway. So here's our folate cycle. Excuse me, this is our methylation cycle. I'm sorry. This is actually our folate cycle, sorry. Our folate cycle, here's our methylation cycle. And then coming down here is what's called our transsulfuration pathway. So TS, transsulfuration, methylation, and folate. So methionine. So methionine sits at the 12 o'clock position within this particular pathway, homocysteine at 6 o'clock. If we think of it as like a clock face. And homocysteine will get converted to methionine through the actions of two enzymes to make that happen. But then methionine needs to get converted back down to homocysteine in order for us to make what's called SAMe. And SAMe is very important for maintaining methylation reactions throughout the body. Methylation reactions that support DNA and RNA, phospholipids, proteins, etc. Cysteine, we know, is important for helping to make glutathione. NAPK can compromise cysteine, NAPK can compromise glutathione. It can also compromise methionine, which is going to overall compromise the methylation cycle. When we look at liver detoxification, we can think of things in phases. We have phase 1, which is our P450 system. So that 2E1 P450, that CYP enzyme, is very important for helping to get rid of acetaminophen. Unfortunately, we make NAPK because of it. But if we can move things from phase 1 to phase 2, so phase 1 reactions are moving things that are more what are called lipid soluble and converting them into water soluble compounds in phase 2. And we need a lot of nutrition in order for that to happen. We also need a lot of nutrition to support what's happening in phase 2, particularly different amino acids And methylation reactions are a part of detoxification pathways in the liver, particularly phase 2. We know that glucuronidation takes place. We know that glucuronidation is weak in young children. Sulfation is critically important. We've got glutathione conjugation. So we know that the presence of acetaminophen can compromise sulfation, can compromise glutathione conjugation, and we're already in a weakened state as a child because of poor glucuronidation. It can also compromise methylation reactions. So SAMe is a big deal. It's a major methyl donor. It is linked to the methylation cycle. And if we've got methionine being compromised because of the presence of NAPGI, it's gonna adversely affect SAMe. And that can have wide sweeping influences throughout the body, as well as just what's happening in the liver. So if we go back and again, look at the major pathways of detoxification, glucuronidation with regards to acetaminophen makes up the bulk of the main pathway, but we know it's already in a weakened state in children. Sulfation makes up a big percentage. In autism, sulfation is often in a weakened state. If we're forming a lot of NAPGI, we're going to be compromising and straining our glutathione reserves over time. And if we're compromising various sulfhydryl group amino acids, part of those play a role in the methylation cycle. And because glucuronidation is the major pathway of acetaminophen detoxification, what happens when this pathway isn't working great, it forces acetaminophen or paracetamol, same thing, to be moved down these other pathways. So now these other pathways have to take up the slack. Well, what if there are other things that are compromising these other pathways? Okay, for example, sulfation, for example, or maybe we're running into glutathione deficiencies because of poor production or other exposures. Now that increases the NAPGI load in the body. So, p-creosol. P-creosol is a particular compound that's produced by certain Clostridia bacteria, particularly Clostridia difficile. P-creosol inhibits the phenyl sulfur transferase enzyme, which makes up about 30% of the metabolism route of acetaminophen. So many autistic individuals have Clostridia bacterial problems found on organic acid testing. We already know that young children have poor glucuronidation. So now we're compromising not only this route, which is most of the route that we take, but now we're compromising this other escape route, which is our phenyl sulfur transferase, which now forces more down the route of NAPGI formation. The problem again is NAPGI needs glutathione. And so too much of this over time will zap essentially our glutathione reserves. And it does so by attacking these thiol groups. Again, consuming more acetaminophen, producing more NAPGI increases the function of 2E1 to just make more NAPGI. So one of the things that I often do in my practice and I teach about in our academy is how to incorporate and use organic acid testing in practice. So this comes from Mosaic Diagnostics, which is the preferred organic acid test. And many individuals we see have many of these Clostridia markers elevated. So we've got creosol, which we know can inhibit that phenyl sulfur transferase enzyme, HPHBA, 4-hydroxyphenylacetic, or other examples. So creosol is produced by Clostridium difficile, or at least certain strains of Clostridium difficile. And it will actually, basically these Clostridia produce it as a way to compete with other Clostridia bacteria in the digestive system. But here's another angle to this story and why this is important with regards to the autism discussion, is that p-creosol, not only does it inhibit the phenyl sulfotransferase or compromise its function to help metabolize acetaminophen, turns out that p-creosol is a neurotoxin as well. It can compromise synaptic function, and it also is a strong inhibitor of this particular enzyme called dopamine beta hydroxylase, which is what helps convert dopamine to norepinephrine. That occurs in the brain as well as the central nervous system, within the sympathetic nervous system particularly. And the reaction of p-creosol against this dopamine beta hydroxylase is irreversible. So once that creosol interacts with that dopamine beta hydroxylase, that enzyme is gone. This doesn't mean it's happening to every single dopamine beta hydroxylase, but it happens to a significant amount. So what's the big deal? Why is that a problem? Well, there are a number of these different Clostridia bacterial compounds that inhibit dopamine beta hydroxylase. 4-creosol is probably the most studied. And so it will affect dopamine beta hydroxylase. What that does over time is it causes dopamine to increase within the nervous system. And at times we can also see norepinephrine and epinephrine decrease over time as well, if it's a long-standing or a significant problem. But what's the big deal about having dopamine build up in the nervous system? Well, dopamine is a very reactive compound. It's typically stored in what are called terminal vesicles within a neuron. We don't want a lot of it leaking into the cytoplasmic space of the cell, of the nerve cell, because it's highly reactive. And when we have excess dopamine that is spilling over into the cytosolic fluid of the cell, it becomes reactive compounds. In one part, it forms something called dopamine O-quinone. And dopamine O-quinone can actually trigger apoptosis of brain cells, basically premature cellular death. Dopamine O-quinone converts into other types of forms, something called cyclidized dopamine O-quinone or cyclidized dopamine O-semiquinone. The bottom line is that these reactions generate oxygen radicals, like a superoxide radical, that can damage nerve cells and lead to neurodegeneration, mitochondrial problems, etc. And guess what? We need glutathione. GSH is glutathione. We need glutathione to try and deal with this dopamine O-quinone formation. But if that dopamine is in a deficient state, we're not going to be able to manage dopamine O-quinone, and it can lead to a lot of oxidative stress and inflammatory reactions in the brain and nervous system. This goes one step further. There's a whole series of reactions of dopamine metabolites, and there's another one. This one is not as well known, but it's called aminochrome. And aminochrome occurs because of dopamine metabolites through oxidative reactions. And what's the problem with aminochrome? Well, aminochrome is actually involved in many different neurodegenerative conditions as well. It can disrupt axon transport and function. That would basically mean the transfer of electrical inflammation of a nerve cell. It can disrupt the cytoskeletal aspect of a nerve cell. That can lead to just a brain derangement in various areas of the brain. Proteasome. A proteasome is a complex that exists in our cells that get rid of old damaged proteins. We need to get rid of these old damaged proteins so that these damaged proteins don't create their own problems within a cell. And if that doesn't happen, there's different proteins that can build up and create problems. Aminochrome is an inhibitor of the mitochondria, and it specifically interferes at a couple different places. Isocitrate dehydrogenase is a chemical reaction within the Krebs cycle. Complex 1 and complex 3 are part of the electron transport chain of mitochondria. What's the main thing to remember? Excess dopamine, dopamine metabolites can cause mitochondrial dysfunction. If this is happening in autism, this is a big problem, because in all of our brains and nervous systems, it takes up or makes up about 20% of the ATP that's produced by mitochondria goes to the function of the brain and nervous system. So learning how to use the organic acid test in practice is critical. Now, this discussion or the use of this isn't just necessarily directed at acetaminophen. It's to understand how many of these clostridic compounds can compromise certain susceptible individuals, as well as being able to analyze mitochondrial function. And we get into great detail in how to utilize, interpret organic acid testing in our Integrative Medicine Academy. So we have the Essential Oat Mastery course and the Advanced Oat Mastery course. So here's where things turn and get even more concerning, if you will. Now, this may be something that many of you haven't heard of before, called sonic hedgehog. What is that, and what is the relationship to autism? And yes, by the way, Sonic Hedgehog was named after the cartoon character. Again, I want to take you back to this article by Shaw. So we talked about acetaminophen. Now let's talk a little bit about sonic hedgehog and what's the relationship. First off, what is sonic hedgehog? Well, sonic hedgehog is a signaling molecule that is particularly important in embryological development, particularly for organizational development of our central nervous system. That would include our brain, our limbs, and our digits. Sonic hedgehog actually is not just produced for embryological development, it's produced throughout our lifetime. And it helps in patterning and differentiation and organization of organ tissues. Our tissues have to be organized and put together in a correct way. And sonic hedgehog is involved in that signaling mechanism to allow proper digit formation, to allow for proper central nervous system brain formation and other organ formation. An abnormal activation of the sonic hedgehog signaling pathways actually have been linked to various malignancies as well. In extreme cases of gene formations linked to sonic hedgehog, we can get all kinds of, again, different malformations. Now, these are very, very extreme scenarios. In fact, there is a condition called alobar holoprosenophily, where essentially a child is born with a cyclops eye. Now, again, there's a spectrum of these kinds of problems, and this is obviously very rare and dramatic. But people who have sort of mild aspects of sonic hedgehog problems can have other malformations that aren't quite obvious, but can be detected, by looking at facial structures or sometimes organ structures throughout the body. So the sonic hedgehog gene is what codes for the sonic hedgehog protein. And this is found on chromosome 7. And what's important to understand is that the sonic hedgehog protein needs to be activated in order for it to have its signaling influence. And it specifically needs to get activated by combining with cholesterol, which, by the way, in autism is often deficient, and palmitic acid. So it needs cholesterol and palmitic acid to become its active form. Okay, so defects in sonic hedgehog, whether it occurs with the activation steps or at the chromosomal level, can lead to malformation or imbalances in proper function and orientation of different tissue layers in the body and organ systems. Now, this is just one example. This is well known in autism. There's different brain regions that are affected, the cerebellum being one of them. The cerebellum is involved in motor skills. It's involved in attention focusing, proprioceptive information, balance. And sonic hedgehog plays a role in cerebellar function. So cerebellar issues in autism are quite prevalent. Okay, it's involved in motor skills, proprioception, attention. And when there is imbalance in cerebellum function, we can also get emotional instability and impulse control problems. Now, the Purkinje neurons, these guys right here, okay, play a major role in cerebellar function. Well, it turns out that sonic hedgehog gets secreted by Purkinje cells. And the sonic hedgehog helps to maintain the division between the different layers within the cerebellum that allow for proper orientation and function. And when these layers get compromised, we have a problem in how the cerebellum organizes information and then transfers that information up to the higher levels of the brain. Now, this was a mouse study, but what they were talking about was that sonic hedgehog is produced by Purkinje cells in the cerebellum and is a potent inducer of granular cell proliferation, basically just proper orientation of the different cell layers within the cerebellum. But it's not just an autism problem. It's not just something that happens in childhood. Remember, sonic hedgehog, this signaling protein, is prevalent throughout our lifetime. And so it is assisting with neural patterning and even neurogenesis, which means the formation of new neurons, okay, throughout our lifetime. And so problems in sonic hedgehog are not only manifesting in kids, but it can be linked to things like Alzheimer's, Parkinson's, and amyotrophic lateral sclerosis, or ALS. So how does acetaminophen interfere with the sonic hedgehog? Well, this essentially is our sonic hedgehog, but in this form, it's inactive. So it has 424 amino acids. One end has a carboxyl group attached. The other end has an amine group attached. And amino acid sequences 1 through 23 and 198 through 424 basically need to come off. Okay, and so we're left over with this amino acid sequence between amino acid 24 to 179. So this essentially would be our active form of our sonic hedgehog. This would be non-active. But the key is this: in order for this to become active sonic hedgehog, it needs to attach to cholesterol and it needs to attach to palmitic acid. Now, palmitic acid is produced in the body and it comes together with something called coenzyme A. Coenzyme A actually needs vitamin B5, pantothenic acid, in order for it to be functional. So what's happening? The bottom line is that if we get complexing of palmitic acid and cholesterol to this section of sonic hedgehog, it's now active and can have its signaling influence. But notice this section of the sonic hedgehog has this HS group. That is a sulfhydryl group, also called a thiol group, because it has the sulfur, which means NAPQ can attach to it. And so acetaminophen and the production of NAPQ can compromise this section of the sonic hedgehog, rendering it inactive, regardless of whether cholesterol attached or not, because it needs both things to happen. And so this is something that is a deep concern, particularly if this is occurring in utero. And so moms or women who are pregnant, who are taking acetaminophen throughout their pregnancy, potentially, and I can't say it's happening in all cases, but potentially increase the risk of altering sonic hedgehog function during embryological development. If this is happening after birth and a child is taking acetaminophen, and maybe perhaps a lot of it, we don't know for sure, we don't know everything, we could still be compromising sonic hedgehog function. So again, acetaminophen has many pathways of detoxification, but we already know that glucuronidation is weak in kids, which means that more of that acetaminophen needs to go down the phenylsulfotransferase system. However, in the presence of 4-creosol, that phenylsulfotransferase transferase system gets compromised. So now all of a sudden we're shuttling more acetaminophen down the NAPG pathway. That NAPG pathway can end up compromising sonic hedgehog, as well as compromising glutathione. And then another part of this that complicates this story is that we can also shunt acetaminophen into another pathway that forms something called 4-methyl-O-benzoquinone. Well, it turns out that this particular compound itself can attach to sonic hedgehog. So which one is doing which in which particular person, it's difficult to know, but this gives you a different, hopefully a different picture of the complexity of what's happening from a metabolic and toxicity standpoint with acetaminophen, and why it could be linked to some individuals' autistic condition, at least in part. So what are some other things about acetaminophen, just as a take home as we wrap this up? Okay, we know that acetaminophen has a major effect on liver toxicity. I showed you a number of different pathways that it could be linked to autism for various reasons. Well, we also know that acetaminophen is greatly toxic to mitochondria. And so it can actually decrease the function of something called ATP synthase. ATP synthase is called complex 5, part of the electron transport chain that makes ATP. It's the thing that synthesizes ATP. The synthase basically means synthesis. So it's making ATP. And acetaminophen will compromise the function of that particular enzyme. And that leads to mitochondrial problems. In fact, in animal studies, they've actually found the mitochondria to be hugely swollen and malfunctioning. And this is primarily happening in the liver, but we can see where these other reactions may be also having systemic effects as well. Okay, so that's the information for acetaminophen, liver damage, and some of the associations with regards to autism. Integrative Medicine Academy, if you want to get more familiar with what we offer, start on the homepage. We've got courses, we've got membership levels. Let me just show you real quickly. If you actually go into the courses and tracks section, we've got individual courses, and then we have what are called specialty core tracks. We have a library of courses. Now, when we're talking about acetaminophen, that information crosses over within the toxicity mastery course, as well as the autism mastery course, and even aspects within the mitochondria mastery course. And then we have what are called core tracks. Core tracks are combinations of different courses. So we have functional, autism mastery, hormone, and mitochondria mastery. We have different membership levels. So you can actually go into the membership level and become an IMA member, or you can also become an IMA mentor member. And so to learn more about those, the requirements, etc., just go into the membership level section. And here's the coupon code. So if you're interested in becoming a member, taking a course, taking one of the tracks, on checkout, you can use webinar 10, gives you a 10% discount on course, on tracks, and membership, and that is good through until October 31st, 2025. So in summary, acetaminophen has long-standing known toxicities. This is nothing new. The sonic hedgehog information is relatively new, but actually the information on NAPG goes back many, many years. It's involved, its metabolism is involved in various mechanisms of harm. Acetaminophen, in many people's opinion, should be used with caution. There's clear information on that just from dosing recommendations, and particularly I think extreme caution in children, and particularly extreme caution in women who are pregnant, just because of some of the information I went through. Acetaminophen is not the sole cause of autism. Okay, there are many potential things that can lead to autism, but this is an important thing to understand. But there are associated risks for autism secondary to acetaminophen exposure. That's well established. So again, it really comes down to individual choice, but being more informed about those choices is extremely important. Okay, so thanks again, everybody. I am Dr. Kurt Woeller for Integrative Medicine Academy. We'll do a few minutes here of some Q&A. So a question here or a comment: so much information, since not every child does not get affected, would there be other factors, environment, genetic SNPs, environment, that could be important? Absolutely. I mean, those are all other factors that need to be looked at. So, you know, the commentary, the acetaminophen being a cause of autism, I think the important thing to understand is that it can be a cause, but not the cause. And the same thing can be said of many other things, from certain vaccine reactions to environmental factors. Most everybody is going to have genetic variants, and so that certainly can be looked at as well. I've had some kids in my practice who regressed into autism, meaning they were typically developing, who had mold exposure and had problems secondary to that. So, but this is a topic I wanted to cover because it is something that we go over in good detail throughout some of the mastery courses that we have. But it's also timely in that it's in the news and people are asking about it. So certainly a lot to gather. And I realize the information on Sonic Hedgehog is not well known, but it's important nonetheless. And yes, there will be a replay of this webinar, as all of these open access webinars are recorded and then put on the website for future reference. So another question: can exposure to acetaminophen trigger cell danger response? That's a great question. I don't know for sure, but likely. If we think of just acetaminophen, all the pathways that are necessary for the body to get rid of it. I mean, we could just look at NAPG. I mean, and NAPG is a toxin to mitochondria. So I guess the question is why wouldn't it be? I mean, why would NAPG not be something that could trigger if other similar compounds, environmental exposures can trigger cell danger response? So it's a good question, certainly is a possibility. Any other questions? Okay, so with that, we will wrap things up. If you have any questions, by the way, you can email to admin@Integrative Medicine Academy if you want to find out more information about the Academy. General questions, with regards to, pricing, different courses, but also make sure just to look through the website too. There's tons of information on the website that is helpful. So with that, everybody, thanks so much for your participation. Hope you found this interesting. We'll see you next time. Take care.